When President Obama's health care law was winding its way through Congress back in 2009 and 2010, you heard this a lot.
If you like your health care plan, you can keep your health care plan. If you like your health care plan, you can keep that. If you like what you're getting, keep it. Nobody's forcing you to shift.
That sales pitch sounds an awful lot like an empty promise. The Affordable Care Act is reportedly forcing millions of insured Americans off their existing plans. CBS has confirmed as many as 2 million people have already been told they're getting dropped. Some experts say that number could rise to 16 million. Industry experts say many Americans will soon start receiving cancellation notices in the mail if they haven't already. The reason? Their current policies for their insurance companies don't meet the 10 minimum standards now mandated under the law, which include maternity care, emergency visits, mental health treatment, and pediatric dental care. A recent NBC investigation found buried in Obamacare regulations from July 2010 is an estimate that because of normal turnover in the individual insurance market, 40 to 67% of customers will not be able to keep their policy. But as recently as the 2012 presidential campaign, Obama was telling voters they could keep their plans, which has critics saying things like this.
I would never, on my key landmark piece of legislation, tell the American people something that was diametrically opposed to the truth over and over and over and over and over and over and over again.
But there's more than one way to digest this, at least according to Obama administration officials. On Twitter, senior advisor to the president, Valerie Jarrett, pointed out nothing in Obamacare forces people out of their health plans. No change is required unless insurance companies change existing plans. True, but Obamacare is the very reason so many insurance companies are changing their policies in the first place. When asked about this, White House Press Secretary Jay Carney wouldn't give any numbers on how many people might be dropped, but did acknowledge many insurance companies are canceling existing policies.
The Affordable Care Act is built on the premise that health care is not a privilege, it's a right, and there should be minimum standards for the plans available to Americans across the country.
The Obama administration argues many of those getting dumped from their plans will actually end up paying less under new policies thanks to federal subsidies. Problem is, with healthcare.gov looking like this, it's tough to know who's eligible. The administration says it expects issues with the website to be resolved by the end of November. For Newsy, I'm Elizabeth Hagedorn.